looks perfect.
This is the nose that you wanted always.
Yes, you are right. It's a Barbie nose.
Hello Vishakha.
Hello, doctor.
Thank you for coming in the afternoon today.
Thank you so much.
I'm seeing you after a long time.
Yes.
And I can see that there are good changes that are seen.
Yeah, thank you so much for inviting me, first of all. And I had to come. You called me, so I have to come, right?
Yeah.
So, yes.
So how confident do you feel now when you step out?
I feel very confident, and the bigger question would be like how comfortable you are now and how normal do you feel. So I actually feel normal, like I get attention, but it's a different kind of attention now. It's not in a way where people are trying to figure out like what I am, what's my identity. No, now they just want to admire, they just want to look at me. So it's different, and life is better than before, of course.
Yeah, I know. Even all our front office girls keep admiring you all the time.
That's so sweet of them, but they all are pretty. I feel like everybody is pretty in this world in their own way, right?
Yeah, of course.
Yes.
Yeah. So when you go and meet new people who don't know you since before, what is the reaction that you feel now? It makes you feel more confident?
There is no reaction as such now, because I think they can't figure out.
Yeah.
When it comes to a trans woman, there's something called pass by, like if they pass as a woman or not, right? Yeah. So before, when I came to you before my surgeries, right, I always had this problem. I told you I can't even step out of my house without makeup, and I'm always very conscious of how I look and what people have to say about me. Everything have changed. I go to gym without makeup, I go to market and everything, so all have been fun, great, and there's no judgment as such now, because things have changed, and I think this is the way which I always wanted to look like, and now I look. So I'm very confident in my skin.
So the surgery has made a positive change to your life?
It has made a great impact on my life. I can say that, because a lot of things have changed after that. And my family was like kind of against it in beginning. But after seeing the result and how everything is in the recovery, it's not something, a huge thing, right?
Yeah.
A recovery also happens like within a week or something, yeah. So they all were happy about it, that I wanted it like since so long and I got it done. So yeah.
Because I keep seeing this in all my patients. See, society knows us by our face. Our face is our identity in the society. No matter what you feel internally, it is what people see you, and that's how they determine your identity. So facial feminization surgery makes a lot of positive impact on all aspects of life. It could be in your interpersonal relationships, it could be in your professional life, and in terms of feeling more confident in your own skin. It's all about feeling confident in what you are. What do you feel?
I feel like, of course, you are right in that. And when it comes to trans women, right, facial feminization surgery is something which is very important, because, it's mismatch of a soul and a body, right? Yeah. They have struggled a long way, and now they're really taking step for themselves and they're changing it, right? So they're just matching this soul and body what they have. So you can go for other surgeries like SRS and breast implant, and there are a lot of other surgeries, right? But as you said, the face is the face, right?
Yeah.
So it's a very important thing for anybody, because we always wanted to look in a certain way since the childhood. When we see yourself in a mirror, okay, we had this imagination that I'll be looking in a certain way in the future. Yeah. But when you grow up in teenage and all that, when changes starts appearing, right, it is not exactly what you expected.
Yeah.
So after a while, when you hit the reality and this is not going to happen, and when you come in a picture and you bring that for them, so it's really a dream come true for people, because something which you want, it's not just a need, or I can say it might be a necessity, because it's very important. It is helpful in the daily life, every step what you take in your day, right? It's always there. You interact with people, you go out shopping, like anything it could be
Absolutely,
work
yeah,
related
yeah,
or your face
yeah,
is your
yeah.
face, it's visible everywhere, right?
Absolutely, yeah.
So I think it's very important, and yeah, it's a great initiative that you are specialized in it and you're taking step ahead to help this woman get it
Yeah,
done.
yeah.
So yes.
And I feel when we do facial feminization surgery in two halves, like how we did the upper face and then the lower face, the recovery was also quite smooth. You don't need to really sit at home for a very long time at a stretch. So doing a facial feminization surgery in two stages makes a lot of sense to me.
Okay, so when I was going through this facial feminization surgery on internet, I had no idea that it is done in two different sets. When I came to you in the past, right, then you told me about it, and I was like, can I just get it done in like once, right?
Yeah,
Because I was in so much of hurry and I was so excited for it, so I was like, let me just get it done at the same time.
yeah.
But once I got like these two parts in a different way, right, different sets, then I realized that it have its own importance and why you do it in a two different
Yes,
sets,
yes.
right? So because the recovery and healing is pretty better, and at the same time, right, I feel like if you do both the parts together, it will make it difficult for you to
Yes,
breathe,
yes.
and
The recovery is that much
yeah,
tougher. Yeah.
yeah, and whatever little you're eating, right, that is also going to be like very difficult. So I think it's a better way to do in a two different sets because the recovery is better and you can heal better way.
Exactly.
So yes, and as you said, like, right, it doesn't have to be like too long of a gap between the two surgeries,
Yeah,
right?
yeah.
So yeah, the way I did it in like 2 or 3 months, people can go for like that.
Exactly. Yeah. And I feel the way to approach your facial feminization surgery has to be with a lot of positivity and with a lot of intention of going with the flow. Don't get too much stressed out about how it is going to be or what is going to happen. You have to trust your plastic surgeon, and there is a lot of hand holding that we do, and we will guide you step by step in this process. Of course, as a patient, all the pain, all the swelling, all the bruising, all the incision marks, everything is for you to bear. But what we as plastic surgeons can give you is mainly emotional support, and we can supervise your journey that okay, everything is on track, because you are doing it for the first time. But having done it for several patients, we can guide you. Okay, your recovery is happening smoothly, and there is nothing that you need to worry about. So I think my job was mainly just to handhold and guide you to the process.
But like as like there's also international patients coming to you, right, for the surgeries. Is it any difference for them and for us like Indians, like when it comes to recovery? Because I think the skin type is different, right?
Yeah.
So is it like we take like a bit early recovery and they take some time, or like is it
varies from person to person. Caucasians, their scars heal better. We as Asians or Indians, we have a wheatish complexion, so our scars tend to look pinkish sometimes, initially at least, and then they heal. So of course we also customize the nose or the other features of the face in such a way that we need to maintain our ethnicity. So the surgery, of course, is customized. For Western patients it's different, and for Indian patients or Asian patients it's slightly different. But in terms of the recovery, I think it's more or less the same.
So do you also have to keep this in mind when you're like performing the surgery, right? This Indian bone structure and the foreign bone structure is different, right? So do you perform surgery on basis of that?
Yes.
Or like you just keep in mind that I have to make the patient look as much as feminine as possible?
Of course, the intention is always to make a patient as feminine as possible, but then these surgeries are customizable, and there is a lot of artistry that goes into the planning. So just by looking at the CT scan, you cannot really plan the work. It is a combination of bone and soft tissue. So the incisions need to be carefully taken. We need to see, for example, how much hairline to lower, how much of eyebrows to lift, because everything has to fit into one single piece. So it's like a jigsaw puzzle. You are putting small pieces together, and then it happens ultimately. But I think with the tools that we have, such as 3D imaging now, and the latest CT scans that we have, machines such as piezo, which we use to shave the bone, the recovery has become that much better. So if you compare it, say 10 years before and now, there has been a lot of advance in this surgery. So I really don't think there is anything to worry about.
And as you said, that 10 years back and now it's totally different, right? Did you had an idea 10 years back that this is what you will be like specializing into it, you'll be changing a lot of people's life like this? Any idea you had?
No, I will be honest with you. I had no idea. I will be sitting one day with Vishakha, and I'll be talking about this surgery here. But I was always interested in facial aesthetic surgeries and in facial plastic surgeries. So I always was quite keen on learning the advances in facial aesthetic surgery, and it was God's wish that we are here today.
So I think it's one thing led to another thing, and now it is, right?
Yeah.
But I'm really glad to see that. I have seen your past work as well. A lot of patient, and the work is like phenomenal, and that is how actually people can trust doctors, after seeing the results on others. And I did went through the Instagram profile and internet. I did see a lot of reviews and all, and that's when I made my mind that yes, I can trust the doctor. And when I came, and the first consultation happened, and after that I got the dates, this, that, and all. So yeah, I think I have got like 2 surgeries from you, right? That one was in the 2 different sets, right?
Yeah.
So yeah.
So it was a good experience for you.
It was a good experience, yes. And now, if in future, if I want to get anything done, I know whom to call and whom to get back.
You're welcome to come.
Yeah, and I know a lot of people. Even I have recommended your name to a lot of people. And being honest, like whatever I have done, I might have a bit of a makeup right now, the lipstick and the gloss. But without makeup, if I go out, nobody can even tell me that I have got something done on my face.
That's good.
And as I said, when I was getting my face done, right, I told you that I don't want to look like somebody. I just want to look myself, feminine version of myself, right? So I think that have worked somewhere or the other, because when I tell people I have got this FFS done, they're like,
they're not
it doesn't.
Able to believe.
Yeah, they're like, it doesn't look like, and everything looks like you don't look fake, you look pretty.
That's a real compliment for me.
Yeah, it's like you don't have like lips. You have known my lips and my cheekbone. They're already like that from the past, right? Yeah. Apart from that, I have never got any injection or anything such done, right? So yeah, that is great to hear when people say that you don't look fake, you look pretty, because that is what I wanted from the beginning. So yeah,
that's good.
So I feel like whatever the patients want, right, you can actually provide them that. If somebody want to have like the bigger cheeks, lips and all, whatever they want, I think you can. So it's a great thing then.
Yeah, these surgeries are customizable. So I first ask the patient, whatever is it when they stand in front of a mirror, what is it that causes them insecurity? Is it their hairline? Is it their forehead? Is it the nose? And everyone has that one feature which causes insecurity in them, and we need to take that into consideration when we do the planning for the surgery.
Great. And do you see any other advancement happening in like something when it comes to facial feminization?
Advances are constantly happening. The trend is now towards minimally invasive procedures. So maybe in the future we'll have some endoscopic options coming in facial feminization, but it will take some time.
And the process right now which is there in the market, and the one which you do, is it the same thing which was done like 10 years back, a decade back?
10 years back we didn't have some of the equipment or machinery that is available now, and of course, as I said, the imaging is different, so we are able to visualize the bones in a better way, the muscles in a better way. So planning has definitely improved, and of course it makes the execution that much easier because you have good tools to do it with. So science is progressing, so we should have some benefit out of it.
And at the same time, there's also this, you being a doctor, I'll just ask this to you, okay? There's this thing that whatever you are, right, just be comfortable in your skin and the way you look, right?
Yeah.
So like, what do you have to, you being a plastic surgeon, right, like do people be more comfortable the way they look, or they should accept themselves like the way they are, or they should just go for what they want?
See, if there are any specific insecurities that a person has, and if that is bothering you, and if you come to me and I feel there is a scientific way of addressing those concerns or insecurities, then why not? It is not something which is harmful, it is not something which is going to create any adverse effect on your life. It will in fact make a positive change in your life. So why not? If you have a hump on the nose and you feel conscious about it, what's wrong in getting rid of it? If you have any insecurity about the body, I see so many girls who are overweight, and even by exercise they are not able to lose weight. So what's the harm in getting rid of that fat? So plastic surgery can contribute in a very positive way in enriching people's lives, and I think that's all that we want, enriching lives.
And when it comes to facial feminization, do we need to go for any retouch or anything in the future, or just that you do one time and then it's all good? It's a one-time investment.
The surgeries are all one time. You can of course work on the skin quality. You can work on something like laser hair reduction. So the polishing, the building is already constructed. What you need is the wallpaper and the coloring. So that's all that is needed.
So I have got done what I desired for, and if you want to get your facial feminization surgeries done, you know where to come. It's Dr. Parag.